East Bay Agency for Children, which was initially called East Bay Activity Center, has been a trailblazing organization since its inception. Originated in Berkeley, California in 1952, EBAC was created by parents of children with autism and other severe emotional challenges to provide services that help children to stay with their families. So since that time, EBAC has evolved into a multi-service organization that serves thousands of kids and families each year through a continuum of programs that range from prevention supports to intensive treatment services. EBAC's history has been one of continued evolution to create and provide impactful and often groundbreaking services that meet evolving community needs. During its first 30 years, EBAC was essentially a one-program organization serving about 20 kids each year in its day treatment program. At the time, there weren't many services for kids with autism, and those that existed primarily required kids to be institutionalized. And so EBAC was created by parents who wanted their kids to get the supports they needed while being able to continue living at home. At the beginning, the organization was really grassroots. It operated on a shoestring budget and counted on the contributions of parents and a group of incredible dedicated staff who had some pretty radical ideas. The staff included people like Christopher Bolas, who is currently a leading figure in psychoanalytic theory and who began his career at EBAC.
Once the kids passed through that door, almost all of them were content with it. I think for the children, it was an incredibly reassuring space. So it was cozy, it was comfortable, it was humane. These were children who were found to be outside the possibility of education within the different school districts. So they were all referred from their schools. They were not teachable. They couldn't be in a classroom. And the question therefore was, well, what do we do with these children? But I just simply knew that this was a very popular place. The parents were incredibly happy to have it there. And I will say, as a testimony to the staff there, we helped those children. Looking back, I think a lot of people must have gone through there and learned how to work with children from that institution. They had an extraordinary staff. Frances Lemon was a genius. She was a clinical genius. Her nickname was Frankie. Frankie Lemon was just a genius. And the other therapists were very, very gifted. Evelyn Apte was a clinical social worker. Elian Weitzner, they had both studied with Anna Freud in London at the Anna Freud Center. So we're talking about people who had the best training in child psychology and child therapy that existed at that time. We were also visited by very eminent people, including Bruno Bettelheim, who was the director and founder of the Orthogenic Center in Chicago. So Bettelheim would come and visit and be amazed by us, if I can put it like that. East Bay Activity Center was a great testimony to the efficacy of psychotherapy.
After 30 years of focusing on this day treatment program, the 1980s saw a significant change and evolution at EBAC. Through a series of mergers, accessing newly available mental health dollars, and some strategic partnerships, EBAC was able to greatly expand its scope in terms of services provided, population served, as well as geography, now serving throughout Alameda County and into Contra Costa County as well. During that pivotal time, David LaPiana was the organization's executive director.
So I first came to EBAC in 1982 when I was just shy of my 28th birthday. And I was maybe 2 years into my career in the nonprofit sector. The board took a chance on me. I stayed for 16 years, and during that time we grew from one small program serving 20 kids in Oakland to 10 programs serving thousands of kids throughout Alameda County. Every program that we began came either with an RFP from the county that we responded to, a school district or a school asking for help a community incident that led to people identifying a problem they wanted to be addressed. So our strategy became, let's be the most nimble and responsive and innovative mental health provider for children in the county. So we've always participated in these county and statewide associations of children's mental health providers, and one of the things that I learned at one of the statewide conferences was that this aspect of Medicaid, which is Medi-Cal in California, called EPSDT, Early Periodic Screening, Detection, and Treatment, was going to be beefed up so that kids who are on Medi-Cal who had a diagnosed mental health condition would be able to get treatment for it without budget limitations that the county normally had. And so this set off a light bulb for me. I went to the county mental health director to talk about it. She was very resistant to the idea. She was worried that there would be audits and disallowances. And so that route wasn't going to work. So we went to the Board of Supervisors. And as they say, you only need to be able to count up to 3. Get 3 votes, and we were able to force the issue for EPSDT to be opened for children's services, which later, over the years, became the largest source of funding for children's mental health services in the county. EBAC served initially kids age 5 to 12, but we knew that those kids were developing problems much earlier, and we had an interest in earlier intervention. And there came a time when we had a board member who, Tony Papp, was the CEO of Children's Hospital, and came to us and said, I've got this nursery school that we run. Children's Hospital is not the right place for it. It's for abused kids. We need to provide mental health services. And could we partner with you and EBAC take over running it? And that became the Therapeutic Nursery School. So 16 years later, when I left EBAC in '98, we had 10 programs serving everything from babies and new moms to Therapeutic Nursery School to day treatment, to the Healthy Start programs that helped immigrant families get their kids into school and get health screenings and all, to the pediatric care, which is now called Circle of Care, which was around families where someone was dying or had died, and the day treatment programs were still sort of the anchor of that, but we realized there was so much more we could do.
One of the critical core elements to EBAC's approach to the work is strengths-based and relational, and that was true in the 80s and 90s, and it continues to be true today. Prior to this, a lot of the approach to treatment had been deficit-focused, so really focusing on the problems that children have. And what EBAC was doing was really focusing on the strengths. So a strong belief that within all kids, they have the internal resources and capacity that with the help of a trusted staff, they can bring out to support them in achieving their hopes and goals for themselves. A great example of that type of trusted staff person is Harold Jefferson, who has been working in EBAC's day treatment program since 1994.
When I started in 1994 at the site, it was still just a small program in the Oakland Hills on a school site. A lot of our approach was we felt that, not that academics wasn't important, because academics is important in these little guys' lives, but we felt that in order for them to learn, we had to peel these layers of trauma and uncertainty and deceit and not trusting adults. We felt that we had to peel those layers off before the kids can learn best. And when you present that to a school, it was a little bit uncomfortable for them. You may have a kid that's in the hallway screaming and yelling, and it was like, hey, you gotta stop that because you gotta get this test done, you gotta get this work done. And that wasn't the approach that we were about. We wanted to get in there and find out, well, where's this coming from? And how could we help? A lot of the work that we did when I started, it was through a lot of play-based therapy, So for example, if we had a kid that was having a hard time, and you would be doing some play-based therapy, and a school person walked by and go, hey, this kid just did something awful and they're playing. You follow me? So it didn't make sense. So that's where the informing and teaching in our methods, if you will, came in, but it was definitely challenging. They saw kids getting better, right? They saw kids being a little bit more calm. They saw kids being a little bit more trusting. They saw kids being a little bit more social, right? They saw kids having a little bit more sense of self. They saw kids being able to have a little bit more control. And yeah, that was good stuff. That was good stuff. The teachers and staff would have some challenges dealing with some of their more difficult kids, and they would come and, hey, you have some advice? Hey, how did you deal with that, right? You know what I mean? So now you start to make that connection. Even administrators, if they had a kid, hey, can you come to my office for a minute? Can we talk about it? How do you guys deal with this, right? So it started from them and saying they had actually some challenges in their classroom as well, and they would come and ask us for some advice. So yeah, so that opened up the window to kind of teach our ways and methods. Yeah. So we had this little boy. So this little number, he was having a day. He was having a day, and I was assigned to him that day, and it was the language and the banging and the cussing and just all day long. It's he and I together. It's a hard day. End of the day comes, and I see his ride come. The bus comes for him to go home. For me, it was like, whew, okay, thank goodness. All right, I needed it. I needed that day to end. So he goes off on the bus, and he gets on the bus, and I'm getting ready to leave and go do my self-care or whatever I do. And all of a sudden, I turn around, and there's this kid coming at me full speed. Full speed. He jumps in my arms with no regard for his safety and obviously mine. And I hold him, and that kid tells me, I'll see you tomorrow. I will see you tomorrow. How dare I not show up tomorrow? How dare I not come to work tomorrow? It's not an option. You're there. You come back to work. They need you. Yeah.
In the 2000s, EBAC continued to grow the continuum of services that it offered to support the needs of families. So this included expanding its Family Resource Center programs, the introduction of new after-school programming, as well as programs that worked with children and youth in the probation system. During this time, there was also continuing change in how the country more generally viewed mental health. So there was a reduction of stigma that resulted in more people seeking and being open to getting help that they could use. And there also was the significant increase in availability of state dollars to do school-based and community-based mental health work. EBAC was able to leverage a newly available federal funding stream. It's a program of Medi-Cal called EPSDT. And so EBAC was able to access this money to significantly expand its school-based mental health services. EBAC did this in partnership with the Alameda County Healthcare Agency. Alex Briscoe, at the time, was the director of the agency who partnered closely with EBAC to do this.
Alameda County and EBAC specifically was at the heart of a movement to center schools in a response at scale to some of the troubles that young people were facing in their social and emotional life. And this movement has now become a national movement, and it's fair to say that EBAC was very much at the forefront of it, as was Alameda County more generally. So yeah, in the early 2000s, Alameda County began a $140 million expansion of school-based mental health services. And EBAC was one of the primary actors in that expansion and really pioneered the nexus of public health and public education. Many of us are so grateful for those lessons that we learned together with providers like EBAC. But yes, very, very, very much fair to say that EBAC was a pioneering provider of school-based mental health services for children, which is meet young people where they're at, not because they meet specific diagnostic criteria, not because they need medications or a hospital bed, because being poor in America is toxic to your social and emotional health. For children of color, for children living in multi-generational poverty, they have grown up in a culture that tells them they're not worth nothing. And at the heart of EBAC's extraordinary work is a love and a connection with young people that says, you are not what they're telling you you are. You are beautiful, you are powerful, you are capable, and the tools of mental health are extremely effective in doing that kind of work. EBAC's engagement with the public sector around Medicaid really takes three fundamental forms. First is a large footprint of services in schools, trying to find young people before they reach high levels of acuity, serving them where they're at, and really breaking ground in this nexus of public health and public education. But they also do work with really high-need young people in intensive service models, often referred to as wraparound. And this is where we often pay providers like EBAC to deeply engage with young people who sometimes have been in the juvenile justice or foster care system, sometimes suffer from a serious mental illness, and wrap them with the supports they need. So not just a 50-minute session, though that's available, but also things like peer counseling and parent partnership and other supports to help young people thrive and grow. So that's that second area that they do. And then finally, EBAC has done groundbreaking work in early childhood mental health services. And little kid mental health is a unique challenge because little kids don't present the same way that adults do. And most of our mental health models are designed around sort of insight-based psychotherapy. So the models of care that we must implement with little children and their families tend to be dyadic, meaning family systems, meaning you treat the mama and the baby together or the caregiver and the child together. And EBAC has pioneered this work with their preschool and their other early childhood services. Since I've known EBAC in the early 2000s, they've had a family systems approach, meaning not isolating the problem in the child's behavior, but looking at the context of that child's experience. Not only what's going on in their family, but what's going on in their community, and also broader societal factors. The vast majority of low-income children, in fact 80%, are children of color. And in Alameda County, it's almost 90%. So in the communities where EBAC works, acknowledging openly the impact of structural racism, of multi-generational poverty, that isn't something you do on the side of your work, it's the heart of your work. And I think EBAC is one of the handful of providers in the state of California that have pioneered the integration of those principles and practices in community mental health work. I give EBAC incredible credit, and I'm so grateful as a recovering bureaucrat for the work that they did charting a course for community mental health for children and families. And without their contribution, none of the things we are seeing across the nation would be possible.
At the time, EBAC's service population grew to include children that were coming from families that were really struggling with poverty. And the organization understood that you can't look at the challenges that kids are experiencing independent of the larger family context that they're coming from. So the organization was able to tap into newly available state dollars to start a family resource center program. So these centers were co-located at school sites where families were already coming, so they were easily accessible to them. And there were places where they could come in and get help enrolling in insurance, finding a place to live, accessing food, and finding out other benefits that could help them. EBAC has always recognized that each community has its own unique needs and has tried very intentionally to ensure that programs reflect that. That has definitely been the case with our family resource centers. Giselle Pineda has been at our Fremont Family Resource Center since day one.
Fremont was beginning to explode in the early 1990s. There was immigration from all over. That's when EBAC began to diversify in ethnicity. I think that EBAC came at a time when it was really needed. And there was so much change with the demographics in Fremont that it was a pilot program. It was brand spanking new. And it was to help kids access basic needs, health insurance, kids who were coming into this country. So EBAC started with, okay, let's find funding to see if we can hire and be more reflective of the community that we serve. And so we started doing that. So, now we're at 9 languages, and it is very reflective of Fremont. My staff have been with me for so many years that I have not hired staff for the last 17 years. We always made it very clear. The work that we do, I mean, you're living vicariously through traumas and through all sorts of heart-wrenching stories, right? So it does, it takes a toll on you, and it's really hard to not take things home. Resource centers, what they are known for, one of their strong suits is that they provide case management. Through case management and assessment, you find out what's going on. So a family can come to you and say, I need Medi-Cal. We're not going to just sit down and do an application. We're going to talk to the family. Do you guys need food or clothing? There's this going on next month. Would you be interested? And so then we open up a conversation that has nothing to do with the Medi-Cal, and we find out more. And that's how you gain trust, right? You have a regular conversation. I'm not here to give you this, I'm here to see how we could support you. So I think that the beauty of Family Resource Centers is establishing that connection with families and getting to know them on a one-on-one, establishing that trust, connecting them to the resources. Yeah.
When I came to EBAC 10 years ago, one of the primary things that we were looking at is how to integrate new learnings on how trauma impacts the populations that we work with, and how do we integrate newly discovered best practices into the work that we were doing. From these learnings, we became excited about the opportunity to share with other organizations and public systems to try and support the advancing of this new knowledge to the betterment of the system as a whole. EBAC eventually partnered with the children's health directors at 6 Bay Area counties to try and work in creating a regional trauma-informed system of care. Ken Epstein was the director of Children's Behavioral Health Services at San Francisco County at that time.
So there was birthed Trauma Transformed, which was birthed from a SAMHSA grant from the federal government to do something radical, which was to actually change the culture of the organizational and bureaucratic system that was serving our people and was inducing trauma in its own staff, and thus inducing trauma in the community. Trauma Transformed is dedicated to the process of helping organizations transform themselves and their culture to be more relational, more inclusive, and more connected to the ability to support their staff, support their organization, to create a healing organization so that they can better heal the community. So Trauma Transformed was innovative in that it took the form of really helping organizations and organizational leadership transform their own culture so that they could better serve the community. And that was new, and it was particularly new in the public health system. It just hadn't been done. And one more thing about that, that's incredibly unusual because counties never let nonprofits into their private business. I mean, it's a this or that kind of situation. And the fact that EBAC was able to develop trust with each and every one of these leaders and each and every one of these organizations and could sit with us as confidential partners, knowing all of where the bad stuff was buried in our organizations and help us emerge and develop this collaboration is a remarkable, remarkable credit to EBAC. And Trauma Transformed and EBAC began then changing the curriculum and changing the work to ensure that racial equity and anti-racism are central to organizational shift and change. Trauma Transformed also hired a very diverse staff of people with lived experience that were able to go into organizations and very particularly put people in places and spaces where their familiarity and reflection for those staff or those services was clear. Somebody had been through the foster care system or the juvenile justice system, or was reflective by being African American, reflective of the staff, or had worked in the agency. And they were very meticulous about making sure that the people that we're serving to help transform the agencies had an implicit and explicit understanding of the struggles and the challenges and the realities of those organizations. Often consultants come in from other states and other places without that kind of transformative and flexible mindset, which is, we're not giving something to you. We're helping you get something that actually fits your culture, your context, and your community. Trauma Transform went to New York to a very complex system in the mental health and hygiene system in New York, where they were being asked to train the maternity hospitals and to train the staff and how to think differently and how to get the practitioners in the hospitals to think differently about the ways in which race and positionality was impacting health outcomes.
One of the problems about the way that services are often structured is that they're really fragmented. So families have a multiplicity of different needs, but they have to go to different places and different providers to get all of these needs met. So at EBAC in recent years, we've tried the best we can to integrate as many services into one as possible. And this has resulted in us closing down a number of standalone programs that we have to integrate them into existing infrastructures. So for instance, our flagship day treatment program was reborn existing in a public school site. Our standalone grief and loss program is now integrated into the practice of all of our family resource centers. And our therapeutic nursery school has become our EBAC program, which goes out to existing preschool and Head Start programs to support young children. Poonam Chashki is EBAC's Senior Director of Intensive Behavioral Health Services, who oversees our EBAC program.
Our early intervention counselors pair up with our mental health clinicians, and they kind of identify what's happening. We are able to meet with the caregiver in the house, kind of develop a structure, model for the parents how to set that structure up and develop a routine from like morning till afternoon. We even go to the house, help them, set that up. We bring them to the school site, help them with the transition in, and then once the child's in the classroom, we're modeling for the teachers how to support the transition, what that schedule structure looks like. During recess or other times, we're supporting the child in social skills or their communication, language development. So it's really hitting all parts of their day. Even now, like we notice kids who have to be transported or going to a different school site, there is a stigma of why they're having these services or what that means. And so we wanted to have a more inclusive kind of model where we came to the school, we provided the services on site, we're more accessible to the families, so that way they didn't have to kind of have that like run around to access services, and we were just there and supporting the child and the family. Being accessible to the families is really the core piece of EBAC's program, is the family engagement component, because without a family involvement, the child is not going to succeed because we can only do so much in the school setting. And so I think having that team approach, the multidisciplinary, really focuses on, hey, it's not just the child, it's the whole environment that the child's in, and how do you support the environment for the child to be successful.
EBAC has an incredible staff full of passionate, incredibly competent leaders. And so one of the areas that we more recently have seen opportunity to make impact is through the development of a training program that isn't just training EBAC staff, but is also open to others in the community.
We take a multidisciplinary approach, and it's not just focusing on the child or the family. We want to make sure any other providers involved, the teachers, the admin, also understand what's happening. So we have a great training department. We have trainings that are really focused for like the early development, we have neurodevelopment of psychology, biology, like geared towards everyone. We identify supports and trainings developed to those topics or themes that are coming up within the community. Definitely trauma-induced stressors, gang violence in a lot of our communities that's occurring. Intimate partner violence is really high up there as well. Then there's also just living in different family dynamics. So we have like some kiddos who are in group homes, some have foster care, multifamily systems, and so kind of developing and providing trainings among those areas as well. And so knowing that my staff are that consistent person for that student really is just fulfilling to know like we're that person who can be there for that student in times of need and growth.
Since 1952, EBAC has been a leader in ensuring that all children, youth, and families have access to critical supports that they need to realize their hopes and dreams for themselves. Every day I come to work is a reminder of how important this work is and an inspiration in the importance of continuing to move it forward.
Well, I think for people like me who have seen a lot of human suffering, and I mean a lot, from working in trauma centers to juvenile detention to young people who've been through extraordinary challenges. And I don't mean in any way to romanticize that suffering. It is horrendous. If they are given the right amount of support, they will thrive and survive despite. And I think why it matters to me is folks like EBAC will get it down and dirty with people in their lowest and most difficult times and join them in their journey to recovery, and they do. Like, despite all of the things stacked against people, they do. They survive and they thrive. And EBAC does that work.